I'm Rod Duff, your host.
And I'm producer Barbie.
And together,
we bring you our podcast,
Insights and Straight Talk. And with that, producer Barbie and I are out. And I'm in. Damn, that was horrible timing. Sorry, guys. I just drank some water. It went down the wrong pipe. Wow, before, when the preview was on, there were 13 people here. Since I came on, 10 of them took cover. Hopefully that'll change. Hopefully I didn't mess that up too much. So we have Dr. Jessica with us today, and with an incredibly wonderful message. I better get off this really quick because I'm going to lose all the audience for you, Jessica. The fascinating thing is we talk about all sorts of topics here on the podcast, and all those topics are focused on the great American middle class, what their needs are, what their interests are, or what they're concerns about. We're not just like a talking heads and any subject. I mean, literally politics and current events. I'm not telling any of you that have been going here anything different. AI, technologies, evolution, getting people that look like me ready for, because automation's coming. It's coming quick, and we're going to talk a little bit. We'll probably slide along the edges of that here in a little bit with Doc, and I'm going to bring her on so we can get the people coming back, because I think I messed it up for you. How you doing?
Hi.
All right. So I just kind of broad brushed it because when you and I were talking in the green room, there was some really good, we know where we're headed here. We've got a new way of a telehealth system that I'm assuming is being fueled. It's been around, not just it's not a year old or anything, but it's starting to, AI is going to really be blended with more and more health practices. And so, Doc, would you get us started here? I need to get people back on. Come on, guys, come back. She's talking now. Come on.
Fair. So nice to meet everyone. I'm Dr. Jessica Edwards. I'm a family medicine physician. I'm licensed in 26 states. I primarily do telehealth with some in-person components. I really kind of got tired of just the way that the system was going into someone's office every single day, arguing with the administrator about them saying, oh, you need to be more efficient and you need to do this and you need to see more patients. And it's like, do you want to see patients with me to see why I can't? Oh, no, I don't want to do that. Then, so I just kind of decided to make my own path last June. And so I've been open for the last year, and really am excited about all of the patients that I'm meeting from all over the country who I'm able to provide great care for. So it's been a great experience for me. And then also from the other side, balancing being a mom, wife, and also a doctor, I don't feel like I have to choose anymore, which has been the greatest part.
Oh, that's, awesome. So, where you're practicing medicine before was in what's called brick and mortar that took you away to get there, to do the tricks and treats, and then come back, right? So, now I'm assuming you do this, like you're doing right now, something along this line. Look at. I'm sorry to cut you off there, Doc, but remember there were like 13 people on, and then when I was talking, everybody left. They said, I don't want to listen to this guy. But now you're talking, and look what happened. Take us back. Grow this group. Help me out here, Doc.
Sounds good. Okay. Yeah. So, I think our healthcare system is extremely flawed. I think that there have been programs that have been created that are supposed to help us. I think there's a big misunderstanding from a lot of sides. And I think that, a lot of politicians just in general, they're like, we're going to fix healthcare. And then they get in and they're like, oh, this is a mess. And then people just start piecemealing it. And so we haven't really had any just big waha, I would say since the
Mhm.
Affordable Care Act. But, one of the things that I like to say is, I don't do politics, I do policy. And so when you look at the fact that our policies actually drive what things look like. So for instance, when you look at, a lot of times talking about Medicaid patients, and there's so many people that have negative things to say of, oh, you guys are taking away from the system, and it's all these women having babies and yada, yada, yada. A lot of people don't even know that 25% of the Medicaid budget in every state actually goes to end of life care for nursing homes.
Oh, really?
Hmm.
No kidding. You mean once they go into a nursing home or
Yeah, for end of life
whatever the
care.
circ?
It
Oh,
supplements
wow.
Medicare
Okay.
for at the end of
Yeah.
life. So
Oh,
obviously,
that's good.
there are people screaming like, yeah, let's cut Medicaid, let's do this, etc. And that's not, it's not a good thing. People think that they're
And it's
hurting
not
one.
gonna happen.
Right.
It's not gonna happen. Come on.
That's it.
The- I agree with you. We don't play politics either. I'm very down the middle, and
Me too.
but we talk about discussion. Good. We talk about discussions that bringing the middle class together, hearing ideas. The elite have much more information, and nothing against anything there, but it isn't about the party. Never has been. It shouldn't be. And there's a whole story. We've done a number of things on this, but basically, you and I just need to come together and as a more powerful unit to get our politicians to start on the right or on the left, start doing stuff for us instead of lining their pockets or making
Correct.
bigger governments, right?
I would totally agree. And it's so interesting. I was reading a couple of things. Black History Month ended a couple of months ago, but I try to make sure that I know my back in February. Yeah. But I try to make sure that I learn a lot about my history just on a regular. And so what's so interesting is,
Now, when you say history, do you mean your personal history or the history of where you came from? Because there's a lot to talk about there.
no, well, I was
Define
saying,
what you're saying there.
Well, I was saying primarily, Black history as it relates and is integrated with American history. And so when you start thinking about some of these states that are coming up with legislation to cut free and discounted lunch programs, when you think about the origin of where they actually started from, no matter how, I would say, controversial this group is, the Black Panther Party, they actually started that. They started the free lunch.
Oh, they did. I
Yeah.
know the Black Panthers 70 area, right?
Yes,
70
that's when they started giving the meals for children on the weekends.
I didn't know they did that.
They did. And so Fred Hampton, so interestingly enough, Fred Hampton was this revolutionary guy. He actually got killed by the police when he was like 21. I mean, they literally like shot up his entire house. But what was so interesting to me is watching videos from the 70s when he was talking to these combined groups of Black people, white people, Hispanic people, Asian people, saying like, we should not be arguing with each other. We should be working together collectively to go after, the bureaucracy. And it was so powerful because even when he was in high school, he was organizing things. He was on the FBI's most wanted list before he was like 18 years old. And so I say all that to say
I remember that. Yeah.
Yes,
It was
there's
like
power in unity.
he was up towards the top of that list too, wasn't he?
Oh yeah,
At that
for sure.
point. Yeah.
And
We've got a spotted history, no doubt.
Right. So I say all that to say that I do think that there are things that we can take from everyone to say, okay, how do we do this better? How do we employ, people from our community? How do we volunteer? How do we like come together to put things together? And so, for me, I've always been a part of the fact that I feel like working people do not have access to the healthcare that they need. If your doctor's office is open, only, from 9 to 5 and everybody's working those same hours, how are you supposed to get healthcare? You have to choose between your job and healthcare. I think there's some like companies that have done a better job of working on getting healthcare to their companies by either having like telehealth or having pretty good insurance programs. But the problem is, let's just be clear, your insurance should not change based on your job.
Yeah, I absolutely. And it becomes, it's another one of these things. we live in the greatest, richest, best developed country in
We do.
probably history. I mean, that was certainly for our time, and there's so much more that we do. And there's so much about cost, and this has always been about cost. This is a great question to come in right now in what you're talking about. Olivia, how can small clinics implement this type of, now I know we haven't gotten into it exactly, but this is a good lead in my opinion, I think.
Yeah, it is. I think small clinics I think doctors need more business training. We are great at patient care, but business is where a lot of us go wrong. And so I decided to get my MBA because I said, if I'm going to run a company, I want to be able to run it right. I want to be able to make the math, because we got people, family.
you got to keep the lights on, right? You got to keep the lights on.
Correct. And so,
and feed your family and big dogs. Sorry,
correct. So I would say, how they can implement those models are, one, utilizing AI. There's nothing to be afraid of when it comes to AI with healthcare. All of the stuff is like secure, it's set up. That actually gives people answers, because oftentimes if you're not utilizing AI, you're depending on manual people to do your work. And let's be honest, people are not always going to be as engaged as you want them to be. People are not always going to be at work every day. So I think utilizing AI to take some of the burden off, particularly when it comes to follow-up messages, sometimes even lab results, and just trying to automate things that help small practices do that.
That is, and probably fairly inexpensively, because there's a margin that any business needs to work with.
Yes.
And doctors have huge medical liability. No, that's not.
Liability
right?
insurance.
The insurances are nuts.
It's like a wedding almost. It's like you go to a place and you're like, hey, I want to rent a medical clinic. They're like, oh, this is a 20% premium. You're like, what? Like, this is crazy. So I would say that I think utilizing that, and then not being afraid to be hybrid and say, you know what, with the way that these insurance reimbursements are, I cannot make myself be in this office every single day, running up the electricity, paying all these people. So I think hybrid is really the way to go, because especially for patients that don't need in-person care, they're like, hey doc, I just need to talk to you and walk through this with you. A lot of my patients do that. We're able to keep them out of the ER. And I see another question here about how we handle mental health support in telemedicine. One of the things that I do is, from a primary care perspective, I make sure that I am available for my patients when they need me. I also try to do a lot of education during these visits to, one, not ask patients these questions before they know me, right? So we utilize a system where during the visit, I can text them a form so I can kind of talk to them, hear their story, and then screen them for depression and anxiety. Because, who wants to tell somebody you don't know about some of your deepest, darkest moments? We also utilize AI to help find some of our specialists. So one of the things, being in 26 states, I can't know everybody. So being able to utilize, I created my own Chat GPT, little sub.
What was the name of your company again? Sorry, what was the name of your
Zara
Medical? That again?
Zara Medical.
Zara Medical.
All right. Yep.
That's right.
And
by the way, towards the end of this, towards the end of the discussion, I'm going to ask you to put your contact information in the private chat, and then I'll copy and paste it over into the comments. I don't know. I don't know why you can't make comments, but maybe if I screw something up, somebody will make a comment, and I'm protected now. They could tell me in private. Anyway, so would you put that information back in and then continue with your thought there? We've got a lot of questions to catch up on.
I see. So I'm going to get to them. So, I would say as far as navigating health insurance, that is the reason that I'm not a cash-based practice. I have been practicing I look very young, but what they say, black don't crack. So
that is so true. The best complexion, man. 100%, no doubt. Absolutely. I'm lingering more and more to the appreciation as my stuff starts to crack.
Don't worry. I can help you with anti-aging stuff. There's a lot of cool stuff out there too. So,
whoa. Sorry, you just said something. Producer Barbie is a part of the show. She comes
Yeah.
on periodically, but she runs a lot of stuff.
Uh-huh.
Today's her birthday.
Happy
And
birthday.
yeah, I sang her a birthday song this morning.
You're not gonna sing it on the
She's
air? I'm just kidding.
huh?
I said
Oh
you're not.
no. I do sing on the air, but I'm not ready right now to do that. I come from a musical family, as does she. But we were just talking about her getting depressed about aging. She just became a grandmother. I've been a grandfather for a while, but yeah, let's approach that because that's a big deal right there.
Yeah, so I would say, a lot of the things when it comes to staying on top of health, I would say like particularly with a lot of my patients who are transitioning out of their 30s into their 40s, perimenopause hits them like a ton of bricks.
Oh my
And
goodness.
I mean, it's like slap in the face. I mean, literally just talked to a patient about that this morning. And so one of the things that I think is that in navigating your health, because I see a question here about how patients can be more proactive, is just asking and saying, hey, this is what's going on. I want to talk about it. Sometimes patients be like on some nonsense, though. They'll send like this like dissertation in the portal and say, can you respond? I can't
I've got
imagine.
this 45-minute
Right.
question. Can you respond to me real quick?
Yeah. So I think it's,
Yeah, that'd
it's
be
having
horrible.
those conversations so that, your doctor can sort of like see what your thoughts are, hear your concerns, hear your reservations, and not being afraid to ask for a workup if you need to. And I think, like with my patient this morning, I try to educate my patients and give them the tools that they need to make the best plan for their health. So I think being in a partnership with your doctor is a lot more effective than being in you have to do this, or if you don't do this, you're going to die. I mean, that may be the case, but to tell somebody that isn't going to make them feel any better, and it's not going to motivate them anymore to do what you're trying to get them to do. So I think that one of the reasons that I have chosen to accept insurance, even though the reimbursement rates aren't that great, et cetera, is because patients need it. Patients go to work every day, sometimes to jobs that they hate, and they hate their boss, and because they need health insurance. They may have people, children, loved ones that have, health conditions, and those things need to be paid for. So don't be afraid to use your insurance. But I do think that this next generation of physicians, they are going to have work-life balance. And so the days of going into the doctor's office like every single day for every single thing, I think those days are really over. But, I would say as far as navigating insurance hurdles, I literally just went to the insurance company website and I applied for all of the plans that I'm in network with. I did it. I called their offices and I just didn't take no for an answer. And so I think the last insurance company I got to network with was United. And this was about a month after the CEO, was murdered. I was.
Hey, what's the deal with that? I mean, I know
Well,
it's bad and everything, but he
child,
wasn't even involved in it. Isn't that crazy?
child. Okay, so let's step back
Can we
and
unpeel that a little bit?
let's talk about it. So what's
Yes.
interesting is United Healthcare has had a really bad reputation over the last couple of years of not covering for things that
Ripping people off.
they have.
Yeah,
We
absolutely.
also have this like delayed pay tactic. Like even when I see patients who have United Healthcare, I mean, I get paid until 45 days after the service. I remember the other day I had a patient, it was something that was really quick. And she was like, yeah, girl, you just got paid. Look, you made all that money real fast. And I was like, let me check and see what insurance plan you have. And she had United. And I was like, I'm not going to get paid for this for like 45 to 60 days after I see you by snail mail paper check.
And that's a big one, right? United is one of the more.
They are.
We're a big
That's
percentage of people needing. Yeah.
Yep. So, I think that is the patient education part, because a lot of people tend to think like, oh, doctors are making all of this money and that's not really the case, because we are not. Oh, I'm sorry. My daughter's closet is right there. Sorry. I stole her room. But, I would say that in general, I think that there have to be more conversations about patients advocating for themselves. I've had some patients that have been.
Hey, you're not getting away with that. What I missed? Where's your daughter? I
No, I
didn't
was saying
see
I'm
her
in
there.
her room and her closet door was open. I think my
Oh,
husband opened her.
in her room?
Yeah, I shoot in her room. She doesn't sleep in her room. She sleeps with me. So,
Aw,
yeah, right.
that's awesome.
So she
And
doesn't
that's
even use
part of the
her
challenge.
room
That's
to my
part of the
office.
challenge that directed you down this path. Sorry for cutting, but
No,
your
right.
family,
Yeah, it was.
you're being a mother, being
Correct.
a raiser of children, not a
Right.
parent, a raiser of children.
Yes.
That's what's really helping
Correct.
AI. Now, when AI is coming into this scheduling and all that, and finding and locating uh, the right expert in this or that field, creating that whole medicine, doctors' involvement in something that needs to be taken care of. Oh, by the way, amazing energy from both hosts and guests. Woo! Right? That's a good one. Yeah, there it is. All right, so go ahead and finish your comments, but I just wanted to kind of expand on that a little bit, if you don't mind.
Yeah. So, I would say that, as a mom, I remember when I was pregnant with my son, my OB was actually one of my attendings because I
First,
knew.
first
Oh,
one.
my first. Yes, my first. I've got two. So when I was going to a doctor who was an OB right across the street because I was like, hey, I'm in fellowship, I'm doing all this stuff. And 3 months literally just wasn't long enough. And so, I was off for 3 months. And I think, there are other countries, particularly in Europe, that have done a better job of saying, how do we support women during this first year of transition? Because you go through so many ebbs and flows. You go from them needing you once every hour and a half to 2 hours to every like 3 to 4 hours. And then, you're leaving them at home or leaving them at a daycare with, people you don't know. And I don't know, it's a lot. And so for me.
Oh my God. Yeah. You know what? I mean, the term even has been around for a while. Latchkey kids.
Right.
I don't know. You're probably not old enough to know
My
that
mama didn't
term,
let
but
me be a latchkey kid, but I know a lot of my friends were. Yep. She
yeah,
made sure she
that's
waited
not
for.
raising a family. Sorry, go ahead.
It's not. No, but you're right. And I think that we need to do a better job as a country of supporting parents during that first year. I'm not necessarily saying that it's like, oh, just give people all this money and da da da, but give people the opportunity to get to know their child, to kind of get into a rhythm. And the United States is the only major developed country that does not have consistent parental leave across the boards.
It's great that you bring that up. Not that you wouldn't have, but I was thinking about this exact thing just a little bit ago, or a couple of days ago, where I think Barbie and I were actually going through today's discussion, and healthcare. I'm sorry, parenting. You talk about just throwing a bunch of money at something. Well, there's some things that our politicians do that for obvious reasons, the benefits that aren't ours. But I got to think, I know for a fact that having parents who raise you, whether they're exactly perfect or not, it doesn't matter, because that child will grow older with a backing, a base, to build from, and versus the child, maybe great parents, successful, they're gone all the time though. And that child's going to have a lot more problems and is going to more than likely put more pressure on the healthcare system.
Correct. I totally agree. And so that's why I have been so proactive with my children. Sometimes, I'll work into the late evening. I think I had one patient who was like, I'm so surprised you had an appointment at 9 o'clock. And I'm like, I'm here to serve. I was like, you might see a, kid getting out of the, coming in saying, mommy, mommy. I was like, but I'm here to serve. But I feel like that actually creates a humanistic aspect to medical care, right? Where they're like, you are your insurance company and you together are paying me for my brain to assess your condition, and make an assessment and a decision regarding what I think would be the best step. And so being able to do that and not have to choose between being there for my kids, missing important, things for them, is the biggest thing. And so what's interesting is I never intended on being a private practice owner. I didn't.
You're reading the next question here,
Yes.
aren't you? Yes. You know what? Certain things become a draw. It's like you said, I never anticipated this, but all of a sudden you see a place that needs to be fixed or filled, meet the
No,
need
that
of
wasn't the
somebody.
case. I got the tea.
No.
You ready?
Yeah.
Are you? So this,
Okay. Hold
a lot
on.
of people think I'm making this up.
Hold on.
You
Okay,
ready?
I'm ready.
You ready?
I'm ready.
Okay.
Ready.
So when I was ending the first year of my first year working in private practice under another physician, I was like, hey, I don't really think this is working. I am thinking of going to work for the hospital system instead. Talk to, the administrators there. And when they tried to beg me to stay, and I was like, no, I'm good. I don't really want to do this anymore with you guys. I was doing family medicine with OB.
Oh, no.
All of my patients who had Medicaid were dismissed from their practice before I left the practice. So
Wow.
I was in this
That's
position.
devastating.
Right. And I was forced to come up with a solution to be able to care for these patients, because we all know the importance of prenatal care as it results in patients' outcomes. And I was like, we already were in a small town, so there weren't too many other places for them to go. My other colleague was already swamped at her practice. She's a workaholic, love her to death, but she already had a ton of patients. So I'm like, we got to figure something out. So my husband has his business degree from Rutgers. And so we actually started off in a My Salon Suite.
In a what?
My Salon Suites, one of like the little where it's like 160. Well, mine was like 320 square feet, but it met everything that I needed. It had the flexibility of the hours. I could come in whenever I wanted. I got to pay weekly. I was able to set up my little office the way I wanted to. I had my little medical chair in there, my printer, all of my lab stuff. And I was able to do medicine on my own terms. And so what was interesting is a lot of the hairstylists started coming to me. They were sending patients to me. Obviously, I didn't stay there for a super long period of time, but it was a great landing spot. And so one of the things that I always tell people is that when you have an idea and you have a plan that you want to do, you can't be worried about what other people think about how you execute that plan, right? Because had I been in my feelings and like, oh, people are going to think this about me because I'm in a My Salon. Listen, it meets all the criteria. Medicaid was happy. By the way, it took me a year to get in network with Medicaid on my own. I literally had to call my state senator, and the next day I sent his office an email. I called, and like 2 days later, I got a letter saying I was in network, and I was like, wow. Okay. But I mean, that's one of the biggest things that I tell people is you can't be worried about what other people think about you, because a lot of the people that are thinking the way that they think about you don't even understand what you're trying to do, how you're trying to do it. And if I had something I could tell my younger self from 10 years ago, it's to be bold, selfless, and don't take shit from anybody.
Yeah. And you will. I mean, no matter what you're doing, the circle of friends and most likely your family is not necessarily going to, hey, that's a little risky. Hey, are you ready to do, and it's all out of love, but you don't get a lot of support when you're leading the pack and taking arrows, right? You're taking arrows through that direct journey, and you don't get a lot of support because people don't understand it and they don't like change,
They don't.
No. So let's pop over here. What do I haven't kept up on the damn messages because I've been chatting with you. But how can patients be more proactive in their own care using telehealth?
I think being proactive is booking an appointment if you have a question. I think it's a lot easier to pin your doctor down during a set time that's available for you where they are focused solely on you. I also think that you can be more proactive, even with telehealth, with making sure that you stay on top of your annual screenings, your blood work, imaging, and things like that, because all of that can be
That
done
stuff doesn't
remotely nowadays.
change. Yeah, that stuff doesn't change, right? You still got to do
Right.
the work. This is
Right.
just that bridge that is as serving the way society is going and the technologies and all that.
Correct.
This is a
And I
fascinating
would say
approach.
for a lot of my patients, and you look at a lot of the statistics and data, CMS, Centers for Medicare and Medicaid, actually eliminated the physical exam component for Medicare annual wellness visits.
Is that a good thing or no?
I think I think it depends, right? Because
Okay.
let's be honest here, right? So I'll tell you, as a primary care physician, typically for each patient that I see, and a lot of people aren't very straightforward about this, but I have no reason to not be straightforward. So I'll typically get compensated around maybe $100 for each patient that I see. So the more patients I see, the more I'm able to make work. But then you have to look at your budget. You have to look at paying for your malpractice. You have to pay for the EHR system. And because I'm licensed in 26 states, I have to pay for a separate system to be able to send prescriptions in other states. You have to pay for a state license in all of those states. If you send narcotics, you have to pay for a DEA in those states. So it's so many different aspects that are going into or coming out of that pot as that money is coming in. So people are like, oh, doctors are making all this money. But if you see 20 patients a day, you're making $100 a patient, that's about $2,000 a day. And by the time you subtract from that, now,
no, it's nothing.
okay, so let's take it a step further and say, okay,
Hold on. Before you go, I now feel guilty, as I'm sure a whole bunch of people out in the audience do, because that forces doctors, practitioners, to kind of come in and run in, do what needs to be done and go to the next one. You're literally forced to be churning mill. You got to get people in. How do we change that so that doctors, practitioners can be practitioners, and it doesn't really matter? I mean, socialism isn't going to be it, but we got to figure some way out to.
Well, one of the countries that
Where is that? What does it look like?
So one of the countries that have gotten it right, no matter how controversial they were in the past, whatever, Germany has gotten it right. They have a basic healthcare system that covers the screening, hospitalization, childbirth, all of the major screening things for doctor's visits, things like that, for everyone. Now, if you have additional things that you would like, you have to pay extra for that. But the basic things are met. When you don't have a basic sort of like system in place to be able to take care of those, what happens, especially in a capitalistic society, you're going to have people that don't have insurance that are going to the hospital because they don't have anywhere else to go. They go to the hospital is going to bill them thousands of dollars because they're billing them the same amount they would charge an insurance company. Then they're going to, at the end of the year, say, oh my gosh, we took this loss. Then they're going to increase their rates. And it's insane. So a lot of people, when they're talking about, oh, doctors are rich and no, we are not. Now, let me take it a step further from the perspective of looking at a specialist that does procedures. So a specialist that does procedures, they're going to see a bunch of patients for a very small range of issues. Not saying those issues are not complex, not saying it's not going to take a lot of time, but they're seeing the same kind of things over and over again. They're not having people come in and say, Doc, I've been fatigued for 6 months. I don't know what else to do. And then you have to go down like rabbit hole of like figuring out what's going on. And, so it's different. And so when they do these procedures, they get paid a lot of money to do those. So the high volume in clinic makes the procedures happen, which then kind of makes it to where that's why cardiologists do really well. OBGYNs that do gynecological surgery do really well. And that's why they're seeing patients on, I wouldn't even say a churning type basis, but, they're able to do that. So when my patients talk to me about, like, for instance,
but you're talking big dollars now, right? Compared to a Sorry.
Oh,
Big
way
dollars.
better. Like
I
the,
mean,
the amount for a
there's a
consultation
reason.
with a specialist is like double
Yeah.
that of what a primary care doctor makes. So if I
Absolutely.
have a patient who's talking to me about circulation from a business perspective and then also an efficiency perspective, it makes more sense to send you to a cardiologist. Why? Because they're going to have the imaging right on site. They're going to be able to get you in. They have all of the fancy equipment. They're going to be able to get everything approved. They've got whole staffs of people that they have that get coverage for insurance. Make the math, and it doesn't with the current reimbursement rates.
Yeah, and now you're talking about not only the ability to actually make come out the other side without seeing all red around you, and so people that have the ability to accelerate the cost of the billing of those can take that amount of time. And now is telemedicine, is this a bridge that, most people that you're talking about now are definitely on the upper end of the great middle class in America. Not everybody's up on that great upper end. So where does that telemedicine, is that kind of a bringing your ability to have a better medical experience without
I
costing
really think so,
world.
because I have patients who I've never met in person. I've been taking care of them for almost a year, and they don't go to anybody else. If they need to see somebody, they're going to book with me. It was so bad. I hired some nurse practitioners, and my patient's like, "I'll wait for Dr. Edwards."
Yeah.
All right. I'll get on the phone. And so I would say that being able to spend time with your doctor the entire 15 minutes of the visit. The average visit only spends like 8 to 10 minutes with the doctor. So to be able to spend that full amount of time with my patients, they're getting everything that they need. We're utilizing technology to make sure that they get their orders. We're utilizing AI to make sure that we refer them to someone that can meet their needs. I often have patients who are not able to take off of work because they have a very high demanding job. And so they're talking to me from their office. I have nurses who are talking to me with their mask on and all of their stuff in the hospital. And it's a beautiful thing to be able to meet people right where they are. And so I think that we have to have a conversation of if we're looking to improve healthcare outcomes and we're not going to touch the insurance companies, how does our government, how does our society help to give more clinicians the opportunity to actually create these practices and try these different ideas? A lot of times, unless you have like a full out research project and plan, it's impossible for private physicians to get an NIH grant.
Interesting. It's crazy. You talked about not being wealthy, right? As a general practitioner and others, obviously, but what we're now starting to be able to get through this new technology, the AI. You're obviously getting the business is attracting because of the right circumstances set up to aid somebody.
Mm-hmm.
With that said, people are used to. Are you getting more younger patients?
I get a mix. I would probably say like
youngers. They're into it, right? The younger
between 18 to like 40, right? And then I probably have 20% of my patients who are between 40 to like that 64 range. Now, one of the things I will tell you is that those patients, a lot of times, they're a little skeptical. But what happens is they're like, I had a patient the other week. She moved to a new area. She started getting on the phone calling, I want to come in for a primary care visit. I need refills on my medication. She's calling these places. They're like, oh, a month, 6 weeks, this. And so she's like, that's too long. I'm going to like withdraw from my medication. So she went to urgent care once, trying to wait it out for that appointment. A couple days before that appointment, they called, hey, it's not funny, but they said, hey, we have to reschedule you. And so she was like, listen, I just went on WebMD And I looked up a doctor in my area. I saw you. I saw
One of the
your
first ones, WebMD. I was going to bring that up earlier. That was kind of the original idea. It's been around for a
right.
long time. It's the
It has
first,
been.
right?
Yes.
So
So
she went
she
on
went on there.
WebMD.
Yes, and she saw my profile. She saw that I had appointments available today. She
Oh,
was able, and
gotcha.
so she booked, and she was like, "I'm going to tell you, because I usually start off my conversation. I don't walk in talking about their health. When I jump on a visit, I'm like, "Hi, good morning. I'm Dr. Evers. So nice to meet you." I tell them a little bit about how I practice medicine, my philosophy, and then I ask, "How can I help you today?" Because that kind of like opens the floor for them to be able to use, and kind of tell me what they need and how I can support them. And so she's like, "I'm really kind of skeptical about this whole telemedicine thing. I don't know how you're going to be able to assess me." And by the end of the visit, she was like, "Oh my gosh, I got everything I needed without having to even go in." She was like, "I got my mammogram ordered. You sent the order to the place. I have a copy of the order. I was able to get referred here. All of my medications have been sent. I've got an after visit summary. And I use an AI scribe, actually. So I'm not
An
even
AI what?
AI scribe. So I don't even type during my doctor's visits."
Ah.
So
So
when
you have a program. Wait, I think I know exactly what you have a program so that when this meeting is occurring, it AI takes notes for you.
extracting the data, takes the notes, puts it in the right place.
I
So I
just
am
started getting into that.
I'm not like,
Right,
and that's
exactly.
typical. That's the typical. I'm
That's
sitting
huge.
here having a conversation with my patient just like you are. The AI system will put the reminders for the little things that I need to do after the visit. And I'm able to be effective with my visits because I can actually listen to my patients, process without having to worry about trying to type so that I can submit the documentation to get paid however long it'll take after the visit.
And you're listening and you're
Yes,
taking in so much more
active
because you're
listening.
not using
Correct.
multiple, this
Correct.
thing going on here. It's
Correct.
huge. It's freaking huge. Now let's flip it around a little bit because you obviously, and I think we're gonna have to jump around subjects just a touch here. They usually
Okay, I'm
hopefully
ready.
connect, but we may have to do a little hopscotching.
That
So
means you just have to have me back.
absolutely, 100%. Absolutely. You got that right. What advice would you give to healthcare startups when they're just starting out? I mean, you've been doing this for years now, and you were planning
Mhm.
it for years before
Yep.
that, and experience before
Yep.
that. So, what's your advice? I mean, you obviously have it.
Oh, child. Let's see. Where do I start? Okay. I would say the I would say the first advice that I would have for clinicians is if you're going to start a startup, understand the business side. Don't do it before you understand the business side because if you don't understand the business side, you're going to be the greatest doctor and you're going to be broke. Secondly, I
You're going to be
would
the greatest doctor living on the street, right?
possibly
So,
depends. I
no,
mean,
I know I'm being this.
so yeah, I mean, I would say that. I would say too, don't bite off more than you can chew. And I would say that from a perspective, people oftentimes try to sell physicians on stuff like these quick money, like, oh, if you just order this for your patients and we'll send it and we'll take care of this. And what they don't understand, and so they want their money up front and they don't give you time to actually get reimbursed by insurance. It's a trap. So, I think one, avoiding the gimmicks. I think thirdly, not trying to scale too fast. I would say, it's really important to just build a brand with yourself first, not only as a clinician, not only as a company, but who are you to make people want to come to your business that you've created that's health tech, right? I also would say don't be afraid to research things on your own. One of the things that happens with health tech is that if you don't understand the tech side of things, you can get duped. People will be having you pay all this money to them to research and come up with this and then not actually give you a working product. And then lastly, I would say you've got to have a balance and you've got to take care of things. It is okay to not go full time starting off. It's okay to do part time. It's okay to do 10, 20 hours a week and balance things out and not take out predatory loans to try to keep your practice open or operable because unfortunately, a lot of times when people see doctors, they see dollar signs, and that is not the case. And you'll find yourself, I would say also get an accountant early on to go over a budget, because I think what a lot of people don't realize is when you're starting a company, even if you're thinking about the person's salary, you've got to think about the payroll taxes on top of that. You've got to think about health insurance costs. You've got to think about, all of the other ancillary things that you'll be paying for.
Wait. That's funny. Sorry, it's not funny, but I'm going to make it a point. Practitioners have to worry about healthcare costs for themselves, right?
Oh, yeah.
Yeah, because you can't operate on yourself.
Nope.
And you're usually not as honest with yourself about your health as somebody
Very
else
true.
would be anyway.
Very
Yeah.
true. Yep. So, I mean,
So-
I would.
Sorry.
Oh, go ahead. No, go ahead.
Go ahead. I was just going to kind of set you up as you're finishing this thought, kind of going in, to what challenges do startups have we're in the middle of that conversation, but you're getting it from all sides, man. You're a woman creating this, what barriers do you have on both sides, right? You're hurdling. So let's hit both that stuff right there, because it's important. There's obviously people, Richens, I think I'm spelling that. Thank you for a question. I appreciate that.
Yeah, I mean, I would say barriers that women face in particular are one, I think oftentimes we're too nice.
Too nice.
Too nice.
So you get taken advantage of.
Correct.
Gotcha. You don't have that warrior mentality.
Yeah, and when you don't set boundaries with, and not even people, but with yourself, to say, okay, today is Sunday. I'm not looking at my computer. I am with my family, right? Or making the decision or making emotional decisions sometimes, right? I would say that the biggest strength that we have just as Americans in general, we have data, we have technology. There is no reason that someone couldn't go on to Chat GPT right now and say, how should I do my schedule? I actually nicknamed my Chat GPT. Her name is Queenie.
Hold on. So you nickname them, your Chat GPT. Mm-hmm. Now I got a follow-up question on that subject. I was just reading an article about it. And a couple of weeks ago, I heard somebody making a comment about it. Do you say please and thank you to your Chat GPT
when you ask it? Yeah, they said 70% of people are.
A lot of people, exactly. It's funny, but you know what's funny about that is a follow-up. The CEO and founder of Chat GPT says being nice to him actually is more expensive. Yep. Yeah, because you're creating a relation, and these things are power hungry, man. Right. I mean, they suck up power big time. I think we all know that. But I'm being dry with my guys, so I took another path. It's such a great tool, though. It's amazing, isn't it?
It is. It has. I think
Google to shame.
The ability to reshape how we learn things, because if you're a learner who can't sit and read a book for 20 hours, you could be somebody that says, hey, can I get there? Me too. You can sit up there and say like, hey, give me 3 major goals that I need to work on based off of all of this information. It's so many things you can do with it. And so I really think that AI is going to transfer things or translate things into education for people. And it was really interesting. I was reading something the other day that I think Bill Gates, he said that doctors and teachers would be completely replaced in the next 10 years. I don't think that's going to happen, but I think that AI will be a great learning tool, because when I got my MBA, I went to Quantic University School of Business and Technology. Shout out to them. It was a mostly AI.
You went where? Sorry, I missed it.
Quantic University School of Business and Technology. They're based out of DC, but they're an AI-driven MBA. So if I was laying in the bed, I was with my kids, because they would crawl all on top of me. I'm sitting here on my computer, on my phone. I could do my lessons right from my phone.
Oh, yeah, true.
And they had an AI tutor that was included in that. So I never really had to reach out to the library or any of that sort of stuff always, because they had the AI tutor right there. And it was like, okay, tell me what you don't understand. It was a very effective tool to be able to get that knowledge of business. And I think that the more people that understand business, the better that you can be, just like in any point of your life. Understanding profit and loss statements, understanding, all of this sort of stuff, because business people always come out on top. It doesn't matter. Like, look at our president. He's gone through different phases of business in so many different industries and so many different things. But when you have business acumen, you can always bounce back. When you don't have that, it's really hard to be able to bounce back and how to change things. So I can answer Papa Lenz's questions about KPIs that I used to measure.
Great question. I was going to ask you if that was I don't know what a KPI is. I told you I'm just the dude trying to get a message out.
Index. So key performance indicators. So typically the things that I use for my patients is one, my referral rate. If I'm referring out more than 10% of my patients, I'm not doing my job. Period. So my current referral rate right now is about at 5%. I also measure the preventive screenings that my patients get, right? So I make sure that we try to get up to 100% every year for colon cancer screening and for mammogram screenings. And then also for my younger patients, making sure that they have labs done once every couple of years to just kind of see where things are in that sense. I would say other KPIs that we use are our reviews. Obviously, I am really big on making sure that patients are happy. I have, I think, 4.8 stars out of like 1,000, 1,300, something like that. That's not.
It's funny. It's funny. A generation ago, that wouldn't have meant anything to anybody.
It wouldn't have been a thing.
Now it's what people live on. Yeah, it wasn't a thing.
That is very cool. Whether somebody sees you, doesn't see you, and so I think that is a huge KPI that I particularly use. And then I also look at, making sure that we meet a certain threshold of appointments per week. But one thing I wish every patient understood about their health is that.
Oh, you're good. Oh, that was so good.
It was a nice little transition. So, I would say that one of the things that I, tell my patients is be clear in explaining what you're feeling. Don't leave things out. Don't say, oh, it's no big deal. Don't brush it off. I think that that's really important. And then I also think that AI will play a bigger role in telehealth soon, because what's going to happen is that you're going to start to have apps that can take a picture of the inside of your throat and tell you whether you have strep or not. You're going to have the ability.
That's already kind of happening now.
It is.
You take images on your phone, it'll tell you what it is, and then it'll drop down in all that information.
Yep.
And just to add to telehealth, when you get into the conversation you were just saying where you're talking to your doctor, it's probably, I know it is. It's a lot more easy, really good wording there, but a lot more easy to have that conversation, especially when it gets personal with somebody who's here instead of I'm talking to you about. Yeah, it's easier to do that on telemedicine, isn't it?
Yes,
I'm assuming.
Yes, it is. And I think especially for patients that have had healthcare trauma in the past, it is a great opportunity just to break the ice.
Yeah,
and to just kind of get to know them, go through their history. And so I think AI is going to play a role, one with clinician efficiency. I think it's going to play a role with diagnostics. 3, I think it's going to play a role with risk stratification for patients. A lot of times, if you can talk a patient, and I don't mean to say this in any sort of way, but if you can talk a patient off the ledge from trying to be Dr. Google, you can actually decrease the amount of healthcare spending. Because I have patients that do this all the time. They're like, I went on ChatGPT, and I'm sitting there, I'm like, And then they're like, they told me that I have this. And I was like, okay. I was like, well, how do you feel about? And they're like, well, I don't know. That's why I'm talking to you. And so I think utilizing that to create more educated patients is going to be a great tool, because the more educated a patient is with their health, the more they can advocate for themselves. And I think particularly in the minority community, we haven't had access to that as nearly as much, because you either have to go on Google, but now there are AI generated things that actually take social determinants of health into account. Because it's one thing that, like, for instance, I had a patient, this was maybe like 3 or 4 months ago, and I didn't even think about it until they said it. And I was like, hey, I was like, we need to work on getting you some more exercise. I was like, how do we incorporate that? I was like, do you want to go on a walk, with your kids? I was like, she had her little one in the background. And I was like, maybe just an, evening stroll. I was like, I know you live, in Chicago. I was like, but, I know you only get like a certain amount of summertime, right? And she's like, she said,
we don't have summertime yet anyway. I mean, today's a really warm day at 50 degrees or whatever, but the wind's blowing, so it feels like 35. I
Right.
get what you're going at
Right.
there.
So when
Yeah.
I spoke with her about this, she said, Dr. Edwards, I kind of live in the hood. It's not safe for me to walk with my app.
Oh, yeah, that too. Up, yeah. Oh, man, that's terrible.
So
I'm
right, right.
so
And I didn't even think about that because I'm like, oh, it's like, yeah. So, a lot of times we have these blanket answers that we give people and say, like, oh, more diet and exercise. Well, we got to start doing more work to figure out, what are you eating? What quantities are you eating? And so there's a really cool app that I've given a lot of my patients called Snap Calorie. And so I'm like, don't try to do the calorie count. Nobody has time for that in today's society. They can literally take a picture of their food. It'll estimate how many calories it is.
oh, wow, that's
And
cool.
the
Hey,
funny story, no, let me tell you a story. The guy who started the company,
right.
his name is Wade Norris. I got a chance to meet him a few months ago. And he was actually a part of the initial team that started the AI with Google. And he just said, I felt like I wasn't really making a big difference with the AI I was doing. So I wanted to try to empower people to take control of their health themselves. And so he came up with this app, and I love it. So when I start telling patients about, these are the type of foods you need to eat, these are the caloric deficits that you need in order to lose weight, et cetera, it actually makes it plain. It explains it to them in real time. And they didn't have to try to book an appointment with me just to get that information.
Wow. Oh, that is very, very cool. I mean, the healthcare system sucks. I mean,
Yep.
as you know, I mean, and we're
Yep.
better than Canada, and
Yep.
certain parts of different places are a little bit better, but we spend so much money
Yep.
on medicine and on this kind of thing that you're talking
Yep.
about now. I'm really curious because AI is changing this. Anybody my age better get on board, because I don't know, you're probably too young, but back when the internet came and the mobile phones came and all that from the old ways, there was a big transition there. People my age that look like me, they became lost. There was a lot of depression out there because they didn't know how to use the tools. They didn't know how to learn. It's a whole new language. AI is a whole new language. It's a digital language that guys like me and women like me, and probably from maybe 45 is a little too young, but from that point up, people really need to learn your this kind of message about every industry and be
Correct.
comfortable with it. We actually have a program coming up about aging Americans in AI. But this is a good question. In the next 5 years, that's just 5 years from now.
Yep.
What do you see? And the AI's there, so it's a hard one. You got to think ahead. You got to think fast. What's going to happen? Where 5 years ago, it'll evolve like this. Whoop, did I lose? Okay, it'll evolve like this and so forth. Now, in 5 years, realistically, it's going to be a completely evolved or changed
Correct.
thing, right?
Yes.
What do you think it looks like?
I think telehealth looks like, and I'll tell you from a primary care perspective, and I'd
Right.
say I'll tell you from like a specialty perspective, right? So telehealth has taken off, like especially in the last few years with a lot of specialty companies. They handle this, but they don't handle this. They do this, but not this. For instance, you think about companies like Hims and Hers. They do some weight loss.
Right.
They do some hair stuff, erectile dysfunction, sexual health, things like that. When
Yep.
it comes to like working up these complex issues, you don't really have patience for that. I think telehealth is going to evolve with a lot of chronic care management, because patients are going to be able to monitor their conditions, manage it, speak to their doctors without having to physically come in for everything. And then also, I think that telehealth is going to become the mainstay of treatment for younger patients. It's for things that are appropriate. There's a thing, I think it's at like 95% of things that are treated on telehealth can be treated in person as well. So it's pretty big.
Wow.
Yeah. So I think it's going to become smarter.
And exactly. And here's the thing. We're already getting used to this. I mean, I can go on my watch. I forgot what the app is called. Samsung Health. And it can tell me my lipioids, my blah blah blahs, my how my health is according,
Yep.
because
Sleep.
your sleep,
Yep.
your stress, your
Blood
eating,
pressure,
you can put in
pulse.
your medicines.
Yep.
That's exactly it's not a personal touch, but that stuff, you know, for a fact, with a personal touch
Right.
is accessible. This isn't
Right.
fantasy world or anything like this. You know, what is the biggest myth about telemedicine that you'd like to clear up? And by the way, we're obviously going to go over now. We actually just went over now. You okay on time right now?
Yeah, I'm good.
You
I'm good. I don't
I've
have
got
any
about,
patient for another hour. I blocked
oh,
off time.
hey, producer Barbie's is perfect. We've got about 4 or 5, 6 more questions at least. They usually pop in again. But what do you see? What is the biggest myth that you want to correct here today?
I want to correct that telehealth is not a good assessment tool for if you're in the middle of a medical crisis. I think that telehealth is a great way to connect with your doctor, for them to see you in real time, to kind of see how you're doing. Doesn't stop your day. It can be a part of their day. And I think that you can get a lot more done on telemedicine that you know.
Yeah, that's big. That's huge. And Branson, thank you very much. I'm going
Thank
to
you.
take all the credit here. I'm going to take
You
all the
should.
credit here.
You
I'm
should.
taking all the. Oh, man, that was too easy. Dang it. Now I feel guilty. All right. So, great episode. So many golden nuggets here. And then, producer Barbie, probably in the next 10 minutes or whatever after we're done. Oh, say that again. I cut you off. Say it
Oh,
again.
I was going to say happy birthday, beautiful.
Oh, there you go. All right. So that's going to be part of our conversation
I still
now.
want
No
that
doubt.
song. I want you to sing
She-
happy.
oh, happy birthday. All right. So there's Barbie saying thank you. Oh, now you got a smile. Wow, she threw in a smile too. Hey, happy birthday. You were ready. You were ready.
It was ready.
Great video, great show. When can we get part 2?
You let me know when you're ready.
All right, we're gonna keep that going. Oh, shit. Now I'm gonna be in trouble.
Yes. Hold on one second. Sorry. Go ahead.
Is that your kid? One of your kids?
My son just got home from school. I guess my husband. Yes. 1 second. 1 second.
Okay,
Hold on,
you got it. You got it.
1 second. 1 second.
You got it. All right. Well, children are children, right? And I'm watching for her to come back on stage. But children are, and Barbie, I was going to tell her birthday song. Oh, jeez. Oh man, you guys are. I did that already. I know you like me watching me get myself embarrassed by because I took vocal lessons. Barbie, you know, you're from a very musical family, as am I, and so I went down that path. But let's see. All right, Barbie, you ready? I'm not ready yet. I have no tone here. I've been talking all day, and my voice is raspy. But happy birthday to you. Happy birthday to you. Happy birthday. Hey, everybody join in. Happy birthday, producer Barbie. Happy birthday to you. Ha! You missed it.
I heard the end of it.
Oh, you did? Okay, I gave that. I look at what she said. She's calling me out. She's like, I'm listening. Birthday song right here. All right. So I'm gonna pick it up with Barbie after a bit. I've got some stuff to go through to close out everything. Don't forget. So
I'm
I'll be
putting it right now.
yeah. When you're in the green room, before you do that, why don't you just say last thought, give a wave, and then oh, it's already in there. See, okay, you're faster than I am. All right, what's your final thoughts? You got a lot of fans here. Man,
my final thoughts are that I really appreciate the opportunity to come on here today. I think that more conversations with doctors in a laid back environment are needed to kind of bust some of the myths that are there. If you don't have a great doctor, holler at me. I'm accepting new patients. I'm licensed in 26 states, and my website is www.zaramedical.com.
Yeah, you know what? I was sitting there talking to you about doing this, and then I got into listening to you, and I didn't copy it over. And got the wrong one. There. And excuse me, there. So we got you up. We got you up there. Anything to say how wonderful I am by any chance?
You
I
are
mean,
really fun and cool. I really enjoyed talking to you today.
I had a great time.
It is just, I think more of these like intergenerational conversations need to happen. I really do.
Yeah. We talk all the time about messages, when you're in your neighborhood, I guarantee everybody down that row, or in front of you are very similar in the needs that they have. The cultural backgrounds are definitely some unique, some not unique, but there's a mixture of, what'd you say, multicultural, right?
Uh-huh.
And yet we all have, at the end of the day, you're a mom. I'm now a grandpa. Well, I've been a grandpa for a long time. I'm a grandpa. So my issues as long as we're in the same age-ish area, doesn't matter what nationality you are or whatever, because the priorities are the same. And we do need to keep talking to each other. So say bye to everybody. You got a bunch of new fans.
Hi, thanks for having me.
Oh, it was a pleasure. Talk to you soon. And if you want to stay in the green room there for a little bit, I've got about 2 or 3 more minutes to kind of close things out, give some updates. We've got a show tomorrow. I think we only have one show, which is great because I don't know if you guys know this. Let's see. Nah, Emma won't watch this. My granddaughter, my first granddaughter, is her name's Emma, and she is right now going into her 16th sweet 16, and grandpa is, and I think, like we said earlier, I think I'm more excited than anybody about this. I'm being obnoxious about it, but that's going out tomorrow, so I'll be able to give some time and finally enjoy it. Guys, as you all know, your support is critical and meaningful, and we're growing, and we want to do this for the rest of our lives. Not only because I just love the hell out of it, but because in my machinery business, which I canceled the last contract about 3-4 weeks ago, something like that. I'm landlocked. I have to stay here. My family is now all in the Southwest, and I got a brand new grandbaby that was just born. Another cute, beautiful girl. But so your support, I really like that and appreciate it, and just want you to know how much it is and how much I see it, and it's just such a cool thing. Hey, I'm Rod Duff, your host of Insights and Straight Talk with producer Barbie, who you heard us communicating with. You'll see her here in a second. She does a lot of the marketing, or is part of the marketing. She does the book, she does the schedules, a lot of things that make this podcast not flop. So say hi to somebody today. Wave at somebody. Create a vibe around you that others are attracted or drawn to, like a moth on a porch light. And come here. We do every day. And what I'm going to say is, I'm Rod Duff, your host of Insights and Straight Talk, and I am out.
Before you leave, if you'd like to watch another one of the podcasts, click the first link in the description. We love having you here, and we appreciate all your support.
And with that, producer Barbie and I are out.